I got Sam when he was 9 months old. He was originally bought to be a hunter prospect and he didn't want to jump, so I entered the land of dressage and here we are, schooling 4th level at home. His whole last year competing though, I had issues with ulcers on and off and just couldn't get ahead of him, so I took him up to MSU to have him scoped and checked out.
I first met Sam in January of 2024. He had been seen at MSU about a month prior for a concern for gastric ulcers. At that time, we did diagnose him with ulcers and with this gastric polyp, so this massive tissue right at kind of the outflow of his stomach into his small intestine. Very appropriately, it was first recommended that we try just medical treatment for the ulcers and see if that resolved some of the signs that his owner was seeing. It did sort of help, but didn't completely abate the clinical signs that she was seeing when I saw him, then about a month later, a month after his first scope. So at that time, we decided to biopsy the mass to see if there was any justification for like antibiotics or additional treatments.
There's 3 different strains of bacteria in the polyp. So the goal was to put him on antibiotic for about 2 months and see if we could get the bacteria cleared up, and maybe that would help the polyp shrink back down, so we wouldn't have to go in and surgically try to go after it. And the antibiotics didn't change anything when we re-scoped in another 4 weeks. And that's when we kind of made the decision to start looking at other alternatives to possibly remove the polyp.
There are some people who will try to snare them with electrocautery. His polyp was really broad-based, so we didn't think we could safely loop anything around it. And we had some colleagues, especially a colleague over in the UK, Dr. Dickie Hepburn, who has been laser ablating a lot of these polyps, and that's actually what's done pretty commonly for people with colonic polyps. They just laser ablate them. So we looked into how we could offer that to Sam.
It is risky because if they laser the wrong part and put a hole in his stomach, there is no going back. So it wasn't something we took lightly, but we knew we tried all other avenues to go after this polyp and it wasn't working. So we decided to give it a shot, and Dr. Bookbinder did her due diligence and all her homework and worked with one of her colleagues in the UK who helped talk her through it. And she was very forthcoming with all the information, the email exchanges, so I felt comfortable. It was still nerve-wracking. It was worth it to try to get him some resolution, because this wasn't something just leaving him out in pasture was going to fix.
What we did was we applied a certain amount of energy or number of joules to the polyp itself, could see that we had blanched the tissue, which meant that we had started to cause it to die, thermal damage, and then we actually scoped him the next day just to make sure the damage had stayed where we expected it. By the 3rd time we saw him, there was just the slightest bit of kind of raised area at the polyp that we ever so slightly ablated with the laser, and then we saw him about 4 months after, and the polyp mass was still gone and the mucosa was totally grossly normal right over it.
It was a lot of fasting for him, a lot of stress driving up to 2 hours on the road each way and spending the night in the hospital. So it's a relief to see that it's gone and that he feels so good.
The huge caveat to this conversation, though, is that we don't ever actually know, because they can't tell us how much it's affecting them. So we're, of course, going to be biased to hope that whatever we did made a big difference for the horse, but that is why this owner communication and really being on the same page is so important, because it was equally likely, and for some of us we were wondering maybe even more likely, that we would go through the expense of this procedure, and even if he had no complications, it wasn't going to do anything for him. So everyone just really needs to be on the same page with that, because like many of the things we do, sometimes we're not sure how much it's clinically affecting the horse.
He's just full of energy, getting used to a new horse that wants to go forward, wants to work, wants to train, and isn't nearly as spooky as he was. You get to know your horse really well, so it just feels good to have a happy partner.